All right, Renee, here we are, and you brought a guest to the episode today, and we're struggling to get started today. So tell us, Renee, what's on the agenda for this week's podcast?
Oh, we do have an awesome guest. My friend Courtney Ackerson, who's a mental health counselor, and she's with the Iowa Mental Health Counselors Association, is joining us today. But before we dive into that conversation, Jason, what is happening on the farm? I think we finally landed in winter. So what is going on up there?
Well, for the last several months, we've been struggling to unload that brand new grain bin that I had built
Mm,
last
yeah.
year, that big, huge bin that now we had trouble unloading.
Mm.
I had to road trip to Illinois to buy a grain vac. And so we are currently in the process of vacuuming from the top that big, gigantic 50,000 bushel bin. So no, things haven't gone well this winter, Renee. So that's going to be my farmer complaint for a very, very long time. But we're making progress now. So there is an upside that we're seeing the light
Wow.
of day, but it's a process.
So before we move forward, does it snow on top of this corn in this bin since you guys are
No,
on the
no, it's
top
all
vacuuming it out? Or
no, it's
no?
all closed in. No, you can still
Well,
close the
that's good
door.
because at
There's
least
just a
that
big
didn't make it
hose going
worse.
in. No, it's not you're not protected from wind. It's cold out. We're up there. It's you stay warm, because it's a 6-inch hose you're having to throw around down into the corn. So it's pretty nice. It's a good workout. So instead of being part of CrossFit, I just go climb around into my, sink down to your knees because it's perfectly dry. So why it's not flowing, who knows? But no, it's a great workout. So it's been my 3 or 4 day workout. So we just do
Wow.
that 3 or 4 days a week and keep the semis rolling, right?
Don't even know what to say. All right, well, let's kick us off today talking with Courtney. So, Courtney and I have been friends now for quite a while. I think we met way back when I was in the legislature back in the good old days, and she's a licensed mental health therapist, and just like I am. And so, we're going to talk today with Courtney. So, Courtney, come on, join us now and tell everybody, let's know more about you. Who are you, and well, what are you
Mm.
doing with Mental Health Counselors Association?
Yes, thanks for having me. This is very exciting. I'm with the executive director for the Iowa Mental Health Counselors Association, or you'll hear us called IMCA. And we are a professional organization that meets the needs of professional licensed counselors in the state, or those who are going to become licensed counselors in the state. So we are a part of a national organization, which is AMCA, so the American Mental Health Counselors Association. We have a wonderful infographic on the bottom of our first page, like our opening page of our website, that describes who is a licensed mental health counselor compared to some other acronyms, such as LISW or LMFTs. So if you need to reference that, you can go there to see some pictures of who are we compared to others.
That's awesome. Because, yeah, that is one of the challenges. We always talk about acronym soup on our podcast and try to help people understand because there's a lot of acronyms in behavioral health. And the more we do, the more there are, right? And so trying to make sure people know who gets help. So, what's the difference in your mind between the local chapter and the national chapter? And why might people pick to be members of one or both? What's the difference?
Yeah. That's a great question. So, the American Mental Health Counselors Association is more dedicated to the overall picture of licensed mental health counselors across the states. And federally, they have often advocated for us on a federal level rather than the state level. So, then each state chapter advocates at their state level. And then we have committees that come together to talk about those different issues, both federally and various states as well. So AMCA is organized a lot like the state chapters in that we have volunteer committees that kind of do all the work, or I shouldn't say all because we have staff too, but do a bulk of the work in that advocacy effort and organization, programming, all of that. So I think it's important to be a part of both because they sort of attack two different issues. One is the state to state, the bigger issues, the federal issues, things like that, and then more at your state and local level, your state chapters can assist with that. Did I answer all the parts of that question? I think I
I
did.
think so. I think so. Thank you so much.
Mhm.
Jason, did you have a thought?
I did, as I'm sitting here and listening to you, tell me more about why it's so important to join a professional organization. I think about there's so many organizations and not just professional organization, but other organizations that assist. What makes that so important and how does that advocacy really help within the state?
I think the group changes over time too, which is a benefit to joining these professional organizations because we are run by volunteers who are in the thick of the practice. we navigate issues in the state at a like relatively fast pace. And so one of the benefits of joining is that there are volunteers who are with you in your practice, whatever that might mean. And we try to have a very diverse group that represents IMCA, whether that's committee members or board members. Some are in private practice, some are in community mental health settings, some are counselor educators. And so I think one of the benefits to having your voice heard is that we collectively gather all of those voices and make them a little bit louder, give you a spot. You see often on Facebook or social media where people are calling for assistance with something. They have an issue, they have a topic that is of concern to them, and they're asking for assistance. And if all of those are brought to the professional organization, we can amplify that voice and be an organized message to the people who need to hear whether that's legislatively or sometimes that's just within the community.
What are the things you're working on this year? Do you guys have legislative priorities? And at the state, you can talk about both levels if you wish, but starting out at the state level for Iowa, what are mental health counselors working on this year?
Yeah, so we kind of have three major areas: workforce development, mental health, like in populations, and professional issues. So one of the workforce development issues is that we're constantly recruiting and making sure that counselors retain their job position, making sure that counselors are there to provide the services for people. One of the ways that we have done this in the past at the state level is making sure that we have programs that help assistance with loan forgiveness. And so that was something a couple of years ago. Renee, you might have even been working on that back when you were working with us. But a couple of years ago, we got funding for loan reimbursement programs, which is extremely important for the sustainability of our profession. We get into the field and we are taking entry level positions that maybe pay lower than a private practice. And we have to start that way. We have to be supervised and have the appropriate background to be able to be independently practicing. And so they need that assistance in those years, especially.
Yeah.
The mental health needs of specific populations, we're working really hard on mental health in school settings. And so we're
Mhm.
looking for to support any legislation that comes across that supports mental health within the school system, K through 12, looking for advancing any specific maybe practices within that field as well. So the Iowa School Counselors Association is another professional organization that we like to support or watch what they're promoting and try to support what they're doing as well. And then the professional issues is name protection for counselors, understanding that counselors is the same as a mental health therapist, and ensuring that the public understands those definitions and our labels. So whether you're an LISW, LMFT, LMHC, you're all therapists if you're in the clinical realm.
Yeah. I am working now with corrections a lot more often, and they call the people that are on the front lines that work with their offenders, they call them counselors, but they're not trained as counselors at all. And they also call psychologists anybody who has a master's degree
Right.
in counseling. I don't even think you have to be licensed. Now you're a
Right.
psychologist if you work in corrections. And that is so very confusing. And I've been working trying to see if we could correct some of that language because it to your point, it just makes it more complicated for people to know what kind of service is somebody going to get. So if a family member or someone hears that so-and-so is the incarcerated individual has so-and-so as their counselor, they may wrongly think they're in some kind of therapy, getting some kind of one-on-one help, when in reality, it really is like a case manager that is actually just helping them with their case while they're incarcerated. And so language matters. And so I appreciate that you work on that because it is confusing for folks. I know there's been tons of work behind the scenes the last couple of years on like the licensing boards trying to get some of that stuff more aligned and your supervision stuff more aligned. Before we move into another topic, how do you think that's going? Some of the things that you've been working on as far as streamlining the board, things like that. How do you feel that any of that's played out? Because we've had a lot of changes around your license over the past, what, 3 to 5 years? So how do you see that working or not working?
Yeah, so funny you bring that up because I just updated one of our newsletters about all of those changes, and I was historically going through I think I started it in 2018,
Yeah.
so that people can realize what the changes are because you'll go in to find a part of your licensing regulation and administrative code in particular, and you can't find it. Or like,
Yeah.
I swear I had to have this many
Yeah.
hours and it changed. And if you were not on the forefront of, that's another reason to pay into these professional organizations. Let them do the hard work of organizing that information for you, right? Pay your dues and then access these newsletters and go look at the resources and use them. But yeah, I've learned a lot of lessons from this. And I'm sure everybody else who's been involved in it has learned a lot of lessons as well. But it's going fine. Probably better than I expected it to go. But one of the laws change. So like when a bill passes and the governor signs it, one of the things I learned is that there's sort of a gap in mechanism to make that bill make sense at every level of the law. And I don't know
Yes.
if other people have seen
Mhm.
that before. I see
Oh,
Jason
yes.
shaking his head.
Yes.
Yeah.
So it became a law, but who needs to follow it and how do we follow it, right? Like, do we actually implement this in day-to-day practice? And so then you see like a lag in the administrative code being updated. So we
Right.
had this law passed a couple of years ago that said, you guys need to get your regulations, all three licenses, LMHTs, LMFTs, and LASWs need to get their regulations into like agreement with the alignment with each other, right? With an end goal in mind and a process in mind. And then we come in with a different law the next year and sign it and throws everything else out of whack, right? Then we have the boards and commissions bill, and then that changed how everything operated. So the poor board, but they're getting there. We now have a structure where we have all of our licensing boards combined and we have advisory committees that just started in, I think, November for each license now. And so that is so directly impactful. Now the advisory committees can actually do more than I think the board was doing before. So that's one of the things that I think is a benefit that I didn't see coming. But if we hadn't had those advisory committees, I'd be very concerned for how much the board could accomplish and if they could even meet, like come into compliance with some of the bills that got signed, right? They need these advisory committees to be able to do that nitty-gritty work.
Right. Yeah, I carry my LMHC and I don't practice a ton one-on-one anymore because of just what I do, but I keep it. But every 2 years, I have to go find the legislation to tell me what I need to do to update my license. And it is a challenge to find it year after year. So I do appreciate that work that you guys do because I can come to your page more likely than not. There's been a newsletter about it or article or FAQ somewhere where it's like, this is the new code section, click here. And that's super helpful. So I can see some real practical things, what your organization can do, because you really can follow the bills. I used to be the one to follow the bills, but now that I'm doing different work, it's impossible. It's too much, too fast, too going on. So I can flip to yours, your list or any other association's list and be like, these are the things that are important to them and see where that is in the process where no way do I have the ability or the time now to track. So there's just some real key pieces. So I as a user and as a member of the association, have appreciated those things specifically now that I just don't have the capacity. It's like, how does anybody doing a full-time job try to keep up? And so
Yeah.
it's great. That's one of the things that you do. So thank you
Yeah,
for
I mean, I
that.
really think about all the challenges. I especially think about people as they move from one state to another state and all the challenge we see, where there's lots of conversation around interstate compacts.
Mm.
But, kind of circling back, I looked up as we were talking there, what do mental health practitioners in Iowa do? I recently became a trainer for a course by the American Psychiatric Foundation. That's a Notice, Talk, Act suicide prevention education tool that's done in schools. And I can tell you that the terms that they use for the professionals in schools don't align with what looks like in Iowa because it's different in every state. And I don't think everyone always understands how much variation there is across the country. When we
Yeah.
look at how do we define those different professionals, that their scope of practice oftentimes overlaps a great deal. And so I think that that's a real challenge as we think about our field and we think about workforce. So I know I threw two or three things out there for you. But as we have an increasingly mobile workforce and we think about workforce shortages and what the association can do to support folks, not only in getting trained, right? Because we have all those hours up front where people need to gather their clinical skills, get supervision, meet the requirements, of their graduate programs. But then if they choose to, if we're recruiting people from out of state, I know a lot of nonprofits that really struggle with this. Then it takes a long time sometimes for all that to catch up. And it's complicated by what you just said. It takes time for those rules to be written and for all of that to happen. And so that puts even more pressure on a strained workforce. So I don't know if you have something to say about that, but that's a lot of what we hear about a lot.
Yeah, we access the addresses for all the licensed individuals every year to announce our conference or continuing education opportunities. And every year I'm shocked that there are more and more people who are not in this state on that license list. And of course we would. That's great because then we can access in Iowa the experts we need for each area, right? We really welcome that. But with the counseling compact, we thought that that was going to happen a lot faster. That counseling compact happened in 2022, 2021. And
Mhm.
every year it's like, we need one more year to get this up and running. But part of that problem right now, or part of the like hiccup last year around June, was that the reciprocity, like kind of exams between states, like we want to make sure
Yeah.
that everybody understands their laws and regulations in each state. And we're realizing that even in Iowa, we didn't have a test like that, a reciprocity test if somebody was coming in. And part of that is because our laws, I mean, I think, well, we didn't have to worry about it as much, but we also have like a code, Iowa code and Iowa administrative code, relatively short, like read your codes and know what to do, right? That's what we're thinking in our heads, I think, when all this started. And then the board is recognizing that across states all over these reciprocity exams are really important to make sure that therapists understand their role, their label in each state, as you were saying, Jason. And
Mhm.
so I think that will be developed in as a part of all this compact development. I think Iowa will eventually come up with a reciprocity that exam so that people coming in understand our laws and regulations. And I at first was a little hesitant because I was not aware of what those looked like, and now I've seen them, and they're fairly simple exams. They're pretty
Mhm.
short. Some of them are very short, and so I think I was fearful that it would hold people back from practicing in this state. But I think it will be beneficial. I think that people will take the exam and be like, I'm so glad I learned that information to make sure that I have to follow all of the rules and regulations in the state.
Mhm.
So that's one of the things you talked about.
I can
Schools
tell you,
and all the labels.
I've had a license in 3 states, and my license has had 3 different names in 3 different states. I was a LPC as a licensed professional counselor in one state. I was an LPCC as a licensed professional clinical counselor in a second state. And then I moved here and I became an LMHC, which is a licensed mental health counselor. Same degree. I took the national exam because I knew when I started out of school, I was in New Mexico and I knew I wasn't going to live there forever. So I was smart enough to at least have the vision that if I took the national exam, it might transfer. But I think I've talked about this on a previous podcast. I think it was a year and a half or 2 years it took me to get my license in Iowa after I moved, because I could not get through the process. And it was I still had the national exam, so I didn't have to take a new exam. It still was a very long, tedious process. And I'm hearing that by itself has improved a lot.
Oh,
And so
completely.
people are getting in a lot quicker because that used to be the big slowdown. People would move to the community maybe with a spouse. And like in my case, my husband got a job at Collins with aerospace and whatever. So I had to find a job, but I couldn't work as a therapist for a season until I could get that done. And so I had to find other things to do or places that would take me on as more of a temporary license, even though I had a license. And it just got complicated. So, I'm grateful. I'm so grateful for these compacts, and it
I
is tedious. I'm excited to see
I
where
was
it
going to say,
goes.
I never got my license. I became an executive. And I never went to the hassle because it was too hard. I got my degree in Pennsylvania and it was too difficult at the time to manage all the supervision hours and make all the transitions that had to happen. And so I just bypassed it because my career took me in a different direction. And so I think, at that time, a lot of people may have gotten those graduate degrees, did all the clinical work, and are like, this is just too much of a hassle. There's too many barriers in place, and I think now we're seeing what happens to the workforce. Those you don't see those things right away. You see those over time.
Yeah.
And I think that that's one of the big barriers sometimes that we have is that we over policy some things, and then there's a balancing act between what do we do to protect the public and make sure we have an adequate workforce, but also making it so there's not so many barriers that you can't ever get into the workplace that really needs you.
And unfortunately, in Iowa, I think the biggest barrier was the paperwork side of things. We didn't have electronic systems for things back in the day. We didn't have
Yep.
everything was manually done, and we were so slow to get some of that stuff in process. And in the meantime, the legislature kept seeing that it was difficult to become a therapist, and they kept trying to decrease our like hours of supervision. They tried to decrease the expectations of getting like a degree and things like that. We don't need that help. That is not helpful. What is helpful is to make sure funding goes into the state state in a way that they can afford these electronic monitoring systems and paperwork systems and making sure things go electronic. We are far too behind the times on that. And I think that was a huge miss for a lot of years. And now we have it. So thank goodness. But that took a very long time for us to catch up at this state level and was very frustrating, Renee. I came from Illinois, so similar process.
Very long.
Yeah, yeah.
Very, very
I
long.
actually have my degree is actually in forensic psychology. And
Oh.
so in other states, I can practice as a psychologist and do assessments and have a different scope of practice, maybe.
Right.
But yeah, in this state, I'm an LMHC. And actually, when
Right.
I moved here, that is when they got rid of the master's level psychologist
Oh.
thing. Again, trying to make less policy and make things less complicated. But in the end, it actually hurt Iowans because we're missing a whole level of
Yep.
licensed individuals now. And I think they thought it was going to make things simpler and less complicated. And in the end, all of those people didn't necessarily become LMHCs like they could have. Like their degrees probably were okay. They could have become that. But in the end, I think they became like the Jasons of the world and said, forget it. I'm going to go work in administration or do something else.
Well,
So
that could
unfortunately-
explain where corrections got to this about being psychologists and all of that, because maybe that was that master's level psychologist position
Yeah.
at one time,
It was.
and they've just never talk about behind the times and changing policies, never really updated all those policies, so the words have stayed in place. And when I figured out the psychologist, I think there's a couple that exist as psychologists, but they're very few and far between. So this position of psychologist that you get paid for, it's not actually your
Those still-
license. And
Those
so
still
it's
exist
crazy.
at state institutions as well, Renee. Those
Yeah.
are still the title at the state institution. I know
So it's
Woodward-
very fascinating
yeah.
to me that it's not the same as a licensing. So maybe,
Oh.
know,
So
once
that
all this.
just changed. That just changed in 2014. And you have to think about how like slow some of those institutional policies
Yes.
and how intricate,
Right.
like again, when a law is made, how it flows down to code, Iowa code, then Iowa administrative code, right? And I think the administrative code is what governs these institutions often. And the administrative code is not being updated when there's a law. And there is the lack of process around that is so frustrating for me to watch. But right now we're in a moratorium. The governor said we can't fix any administrative code. We put them all through review. And now we have laws that got passed where our administrative code doesn't match. So we just have verbal acknowledgement of like one of the requirements is that we have a 24-hour supervision of our, like when we're in our temp license. And that got a law overturned the Iowa administrative code on that, right? And now we can't change administrative code to match it. So we're sitting here. So I'm sure some of those institutions, maybe they can't change their administrative code that rules their
Right.
that like there's no mechanism to change some of that. And so then they've made policies around it and practice. So Renee and Jason, put your minds together and fix that issue, okay?
There's
Wow.
not enough. Yeah, that would take. Wow. I can't even start there.
I used to work in PMIC and there was that's a psychiatric, alphabet soup, psychiatric
Right.
mental institute for children. So residential facility for children who couldn't be safe in their homes. And it is a last resort, much needed service. It was such an amazing experience, but they're the same way. They had administrative code that governed what they did. And they had groups that met constantly. And I cannot imagine all the state institutions having time to meet like those PMICs that various levels of the PMIC administration met together and had meetings about these things so that changes could be updated. And that was a really cool platform to see when I was very young in my field. So
Well, and I think, as we talk, we think about this is why associations are so important, is because there's so much interconnection. I really think about schools and this push to put more therapists in schools. Well, that really overlaps with professional school counselors. And, that whole field has really changed over the last 2 decades of what does a school counselor do? What is their role? It's no longer scheduling, and so many, the program I went to for grad school 20 years ago, I shouldn't say that out loud, should I? It was the same program, whether I went in to a clinical program or I wanted to become a school counselor. The only difference was the internship at the end. The core classes and everything I did was exactly the same. And so we start looking at the content for all of those positions really became similar over the last couple of decades. The practice has changed, right? And how you get licensed, who you're licensed through, whether it's Department of Ed, whether it's someone else, but really looking at that overlap. And then how are we working in different systems to better understand and support people, because there's a whole different ethical code of conduct depending
Mhm.
on which certification, which license. And so that becomes very complicated, especially if you're in a small rural area. You know, Courtney, we spend a lot of time in rural areas, and you don't get to choose from different people. You get one person, and they happen to have the degree they had when they moved to that small community, and then they're expected to do a whole lot. And I think that that gets very complicated because all of the barriers that we just went through the first half of the show really outline then how difficult it is not only to provide services to people who are in need, to support people with mental illness, to support kids who are struggling, maybe during an emotional crisis, but then the funding and reimbursement on top of that, because that's all also driven through this. And I think that associations play a key role in helping us to peel that onion, because as
Mhm.
it's very, very complex and it's very, very complicated, and there aren't any easy solutions to this. It just gets more complicated the more we start to understand. And I think that that's why it's so important to be engaged. You know, you're engaged in that policy piece. And that's why this is so important for our listeners to better understand that you just don't get to go say, you know what, we want to change this one law. They're going to pass it and everything's going to be okay. And our workforce challenges are fixed. That's not the way it really works.
Gosh, I wish. Oh, yeah. No, that's so true. And professional organizations are so important because they see you through all of those changes to the nitty-gritty details, right? And making sure that you're educated in like if a new, not just about the new legislation or law that passes, but about the things you need to know to get your job done too, right? The ethics behind it, the all of the changing landscapes and things like that. You know, licensed mental health counselors couldn't bill Medicaid or Medicare for a long time,
Right.
years. And just within the past 2 years, we've passed like federal legislation so that we can now bill the same way that social workers have been seen. And our jobs are very similar, even though philosophically they're educated differently. That we are all therapists, we are all mental health therapists. And so that has been a big adjustment. But professional organizations and the collaboration they've made with other entities and coalitions, now we rolled out like nationally, AMCA, the American Mental Health Counselors Association, rolled out like a 6-part or maybe it was like an 8-part series on training people who need to bill Medicare and how you do that, how you get enrolled, how you
Yep.
disenroll, aging populations that we hadn't seen before. Now, if you haven't focused on those, let's get us some education around that, right? Suicidality, especially in those new populations that you're seeing, medical needs in that population. So professional organizations are so important to make sure that all of that is well-rounded and rounded out. So even though something happens and you want to wave a magic wand and start billing Medicare, slow your roll and get the what you need from everybody around you who's there to support you, including professional organizations.
Awesome. I couldn't agree more. Courtney, is there some stuff coming up? Do you have events coming up? Or how can listeners,
Man.
you know, that are listening to this today get plugged into the work that you're doing?
Yeah, we have some really great events coming up. So first we have our Day on the Hill is February 27th, and we're starting bright and early with a legislative breakfast at 7:30, and then we'll be lobbying through around noon at the Capitol. And then we have another larger mental health day on the Hill that I really would love, like just anybody listening to come to. If mental health is your priority, you'll want to be at the Hill on this day. So it's April 2nd, and it's we have NAMI there, we have MindSpring, we have American Counseling Association, which is another professional organization. We have school counselors, social work. Like we like it will be a huge day on the Hill. So come be a part of that April 2nd. There'll be some programming from NAMI in the morning, and various organizations are all going to separate and do their own programming in the morning. And then afternoon, we will all be in the rotunda on the second floor with tables, and we'll have that um, hoopla out. And then we'll be talking with legislators upstairs as well afternoon. Then we have our conference, May 7th, 8th, and 9th. So our annual conference is huge. Last year we hit over 400 registered attendees, so that's exciting. We have hybrid options so that you can attend virtually or in person. We would love to see you in person, but we also acknowledge that we want to hit every corner of Iowa, and sometimes to be able to do that, we don't need you to drive 3 hours to get here. We want you to be able to access this continuing education. So that is a hybrid event, May 7th, 8th, and 9th. It'll be 24 different options. I think it was like 24 different options of breakouts and keynotes and all that jazz. And 2.5 days, 13 CEs, continuing education things. So yeah, I think that kind of rounds
Awesome.
out our events.
And we'll include all that in the show notes, won't we, Renee?
Yeah, we will. I'm excited when this podcast comes out on it is the 25th. So you have 2 days. So you can get to the Day on the Hill, which will be very exciting. So we'll be able to promote that for you and get people to the right place at the right time. So I'm excited about that. Also, just for all of those that are listening, maybe you don't know about the conference. One of the coolest parts is what she said at the very, very end, the 13 CEs, because we're still required to get a whole lot of continuing education. And it's a
Yeah.
one-stop shop. If you take a couple of days, it's fun to network with all of your peers, but it's also really cool just to get all of that kind of done. Otherwise, I don't know about the rest of you, but sometimes I'm at the end of that 2 year time frame trying to scram together what in the world did I do these last 2 years to get my license, and that's the worst. So I try to hit one of these conferences and make sure that I get a lot, and it's such just a real value for your time, energy, and your money. And so it's really cool you have the virtual choice too, because it is sometimes hard to get to it every day, but yet you can still plug in. So appreciative of that. So we'll have it all named out. Before we wrap up, though, we want to talk a little bit about some of the associations we've worked with and point you in some directions to other podcasts we've talked about with other associations, because you might be thinking, well, I'm interested in knowing more about this. And some of our listeners are in Nebraska. And so, Jason, you want to talk about a couple of different associations you've worked with there, because they might be wanting to know like where they might get some similar information in their state.
Absolutely. We've worked with several associations in Nebraska, and I think it's great because a lot of our work is with provider groups, but a lot of times those provider groups are directly connected with the professional organizations that represent the professionals. And so, we've worked alongside a lot of those provider groups. We just met. Annette was just on our podcast here a couple weeks ago, I believe.
Mhm.
Renee, and so she does a lot of work with not only physician groups but the counseling association, psychologists in Nebraska. And so we've really been able to gather a lot of information. Every now and then we have to do surveys, and what's a better way to get survey data than to be able to partner with those associations and figure out what's really happening on the ground. So much of our work is providing feedback directly to legislators.
Yeah.
And so the best way to do that is to garner data from the associations and the folks actually in the field doing that work. And so when we're able to leverage those, it really helps. And so we think about all of those groups who are part of those associations, and then how it all overlaps and how the system works together when we're connecting hospital associations to nonprofit and provider associations of behavioral health services or children's services, and then how they link then to all those different groups, from physician groups to counselors to substance abuse counselors, of how those things all tie together. And that's why I think these conversations are so important, because a lot of the legislative priorities are very much the same. But we just need to make sure that people don't end up fighting each other over something that helps everyone at the end of the day. And sometimes we see that it doesn't go so smoothly when it really should be going much more smoothly than it is.
Yeah, I was just thinking about, you and I were at the State Agricultural Rural Leaders Conference there at the beginning of January. And one of the speakers that spoke with me during the time slot, she was talking about Illinois and how they did some legislation to bolster
Right,
rural healthcare providers of all
right.
kinds. There's legislation now in Iowa already about that exact same topic. And so that's where the conference piece comes in, because I know what you didn't mention is there's an AMCA conference too at the national level. And sometimes there's legislation provided or talked about or discussed. And there's sometimes even at our state, you'll have your lobbyist come and chat about what's going on in the Iowa legislature. And it can give you an idea, oh, hey, that's working in this state. Maybe that's something we can do for workforce in our state. And so you can see that, but you don't know that if you don't spend the time going to the conference. So there's really value in coming, because first of all, you can hear about what may be happening in a different state. You bring in keynotes from different places, learn what they know, right? And I'm sure, do you have anybody specific you're really excited about to have at the conference this year, Courtney,
Oh my
before?
gosh, so many. We're bringing in Brian and Stefania. They had presented in 2018, and our whole conference theme is a throwback theme. And they were just such a
Ooh,
loved presentation, and they're bringing a new topic. So it's kind of a spin on what they did before, so that it's not a
awesome.
repeat. But I'm so excited. They're coming from the East Coast. I can't remember exactly where they're from, or even if they're from two different states, but they're going to talk about a case study on domestic violence. And I'm super pumped about that. I love that we bring in entities from last year. We had a presenter from Florida, Minnesota. Can't remember if there was another state, but I love that. The national conference, I'm very excited. You're right. We're going to actually have a time carved out for the Council of Committees for AMCA. So I'm also the president-elect for AMCA, and I plan the national conference for AMCA. And so that is June. 24th through 27th. I had to look at my cheat sheet there. At the Flamingo Hotel in Las Vegas, and we will have a carved out time for our states to get together and talk about those issues. And the other thing that you sort of mentioned is at these conferences, we can connect to other entities, other groups, other tabling exhibitors or coalitions and things like that, where we can not step on each other's toes with legislation and make sure that we are supporting various other topics. So I love that you talked about that, Jason, because that's so important to not get in the way of somebody else's mission if they're also in the same mission as you.
Yeah.
So,
And
yeah.
I can't think of a better place to talk about mental health and addiction than Las Vegas. I can just tell you right now.
Well, what's funny is the AA convention, the first year we went to Vegas, we were real nervous about like, will this draw attendees? It's such a good spot to travel
Oh, it's
to,
a
and it's
great
so
conference
cheap.
venue. Right.
Yeah, it's such a great conference venue, and we
It
hated to
is.
turn down the opportunity. And then the AA conference was there that year. The Alcoholics Anonymous
Yeah.
had it in Vegas that same year, and I was
Yeah.
like, well, then we're good.
We're
We're
good.
good to go.
That's fun. Well, before we go, we always close out with a self-care tip of the week from the recovering politician. And so today we're going to talk about something you might not have thought about, but did you know that counselors need counselors too? Did you know that? I'm reading a really good book. If you haven't read it, it's called Maybe You Should Talk to Someone by Lori Gottlieb. It's a very good book. She's a psychotherapist who needed to find a psychotherapist after kind of a difficult season in life. She had a big breakup with a boyfriend, midlife crisis, all these things sort of crashed at the same time. And just tells her experience of going to work as a therapist while going across town to see a therapist. And it's really fun. It's enlightening. It's very heartfelt. And if you're a provider out listening today and you're like, sometimes I need help too, we all do. And so I know I've been in the seasons like that, seeking help of myself. And there's always somebody in the professional field who that's one of their specialties is working with other therapists. And I have learned they will make slots for you because you are a therapist and what you do is so important that there are people a little bit further ahead of all of us that are like, hey, I will work with therapists because we want to make sure, one, that you stay healthy and stay in the profession. And so it's a really cool opportunity. So I always think about the fact that, you would never take your car to a car mechanic who didn't trust mechanics. You just wouldn't. And you wouldn't really go to a doctor who doesn't believe in going to a doctor. So why in the world would you want to be a therapist that doesn't believe in therapy? If you can't believe in your own practice, what in the world are we all doing? So I would just think about today as we kind of talk through all of this with associations, that's another really great opportunity at those conferences, getting together with people is even if it's not direct therapy, maybe you just need mentors, you need friendship, you need networks. All of those things can coming to down the hill, finding like-minded people to talk to, going to these conferences and learning from others and being able to spend some time together. That's the best part I think about a conference really is what happens after the conference and all of the friend making and the networking. So just think about, counselors need counselors too. So Courtney, before we go, anything you'd like to share that you're thinking about that kind of last minute that you want to let our listeners know about?
No, I just thank you for the space and the work you guys are doing to get these messages out into the public. And thank you for having me.
Well, we're glad you were here. So today, everybody, everything was all about the Mental Health Counselors Association at the Iowa level and at the national level. What's good about it, what you can get out of it, all the different crazy things that they follow and all the intricate details that they'll know. And they'll answer your questions when you're too busy to know it. So that's an awesome opportunity to dive in. Tons of stuff in the show notes, lots of opportunities to plug in. So don't forget before you go, please follow us on LinkedIn, Facebook, and YouTube somewhere. If you leave us a great review, we have a prize we'll send your way. Thanks, everybody. See you next time.